For so many cancer patients, hair loss is the most traumatic side effect of chemotherapy. Now, the cold cap, which is more popular in Europe, is starting to get some attention here as a method of keeping your hair after chemo. The treatment is controversial, and there are skeptics in the medical community. Juju talked to cancer patients who tried the icy therapy to save their hair, and you tried it too, didn't you, Juju?
I did, just to get a feel for it. But, you know, this is one of those examples where, as you mentioned earlier, some women actually forego chemotherapy because they can't stand the idea of the hair loss. But this treatment isn't about vanity, it's about empowerment, patient empowerment. And now doctors are beginning to reconsider this approach, all thanks to persistent patients. Women who are networking with other women over the internet, women like Shirley Billingmeyer, who went on a routine mammogram this spring and got the call every woman dreads.
They called on my cell phone, and the first thing they said to me is, "Are you driving?" And you know right away. My husband and my son were going to be coming home, and so I get home, they are right behind me. And they pulled up and I told them.
Shirley Billingmeyer was diagnosed with breast cancer. Her prognosis was good, but a lumpectomy, radiation, and chemotherapy lay ahead.
Dr. Zander told me, absolutely, my hair was going to be gone. There was not even a question.
But then a conversation with a girlfriend opened a door.
She said, "Did you hear that Kathy didn't lose her hair?" And that's when I started learning about the penguin cold caps.
It's a wildly simple idea. Frozen caps keep your scalp very cold during chemo and somehow prevent hair loss. One theory, vasoconstriction, or the shrinking of blood vessels, the body's own response to cold, somehow protecting hair follicles from the toxic chemicals. But poor results back in the 80s left Shirley's oncologist, Paul Zander, skeptical.
In general, in the past, we have not had a lot of success with it.
But Shirley's dream team gave it a try anyway, changing caps every 30 minutes for 7 hours on each treatment day. Her friend Nancy says the challenge was a welcome distraction.
It really was a three-ring circus. There's like an assembly line passing caps down and taking caps off.
It's like Dr. Zander would say, there's no room for anybody to be sick here because it was just such a positive feeling.
It seems silly to say that chemo was this happy day, but it was this enormously positive, upbeat thing.
But would it work? See for yourself. After being told she'd definitely lose all her hair, this is Shirley after her final treatment.
My hair is all there, so it definitely works.
In fact, a batch of recent studies suggests that 70% of cold cap users keep their hair. But a number of cancer specialists told us they're concerned that blocking chemotherapy from hair follicles in turn may leave the scalp at increased risk for developing cancer down the road. Today, the once skeptical Dr. Zander embraces cold caps, though he agrees more research is needed.
I think that's well balanced by the people who preserve their hair and get therapy they needed rather than decline therapy and have a clear increased risk.
According to the manufacturer, cold caps have worked for thousands of patients in Europe and more than 100 in the U.S. But we found only a few hospitals here that support their use. Shirley and Nancy started the Rapunzel Project to change that.
We looked at each other and said, it's wrong that no one knows about this.
I'm reading around -30°C.
Dita Reimer convinced New York Presbyterian Weill Cornell Medical Center to let her use cold caps during her chemotherapy. She helped me try one on.
Okay, that's cold. You know what I'm thinking as I'm feeling a tremendous amount of cold is, if this is going to save my hair, this is not so bad.
Exactly.
Yeah.
The regimen that Dita used, 100% of women lose 100% of their hair.
So wait, you beat the odds. It's like, take that, cancer.
Yes, that's exactly what it is.
If you guys had to do this chemotherapy, would you do the cold caps?
I would join our study.
Cold cap veterans say the victory is much more than skin deep.
It gives you an overall sense of control, that you can do something with this disease that can be out of control. This is something you can do. It's part of the fight.
The great news is both Dita and Shirley are cancer-free. The Rapunzel Project donated a freezer to New York Hospital, which is about to begin studying cold caps. Everyone we talked to about how the cold caps are not only about saving your hair, but allowing you to escape looking sick, which in turn helps you feel less sick. And it forced them to create a circle of care, something that Dr. Marie talks about a lot. a group of loved ones who can love and support you throughout the process.
And let's bring in Dr. Marie Savard in this conversation, because we've seen this was with breast cancer patients. Are there some cancers where this should not be used?
Yeah, this is not, the cold cap is not for everyone. So for example, if you have what we call a blood-borne type of cancer, a lymphoma, leukemia, something you see a lot of young kids will have, it is not for them, because the concern there is that the blood does circulate and you would possibly have cancer cells on the scalp. You want that chemotherapy to get everywhere. So
and that's not the case with breast cancer.
With breast cancer, it's a preventive treatment. Patients who are undergoing preventive chemotherapy, and they're getting just a short course, and they're getting it in over a few hours' time, like a pulse therapy. So the idea that the ice works makes sense. On the other hand, we also know that for preventive treatment for breast cancer, it's very unusual, very rare to see a cancer develop in the scalp or the skull area. So again, that's a very positive reason why there's interest.
Yeah, and Juju, the cost of this, I would imagine insurance doesn't cover this.
No, it doesn't. And, you know, if you have to use the dry ice to cool the caps, it's like you have to rent the caps themselves and then buy the dry ice. It can be about $1,500. And clearly, insurance is not going to cover something that hasn't been thoroughly studied. And that's what's beginning to happen. UCSF is beginning to study it. New York Hospital is beginning to study it. And once the data come in, I think it'll become more widely accepted. I
got to tell you, I did not know about this when I went through breast cancer in 2007. And I'm sitting here and I'm wondering, like, would I have done it? And I would have liked to have known, and I don't know if I would have, because there's a part of me that feels that the chemo was working. That because losing the hair, and I was eventually assured that I get a little emotional when I'm talking about, sorry, and seeing this, that it was going to fight the cancer.
It was working.
And you want to do everything that you can. And there are some, we should say, there are some chemotherapy treatments where you don't lose your hair, but the Red Devil, you do.
That's true. I think for doctors who, we often will ask our physicians about that, and they don't even know that it's being tried again in newer ways. In the 1980s, when I was training, we would talk about it. It was something that was used, but the research wasn't very good. People used kind of like a shower cap with ice cubes, and the technique wasn't as good. We didn't use it as long. I'm interested that there is some hope that this might be a technique that will work for many patients. So I do think we have to pay attention. We need a lot more study. Yes, we need to follow patients. There is the concern, as you said, you want to know that the chemotherapy is working. Trust me, there are other ways I think that your body tells you that the chemotherapy is working, for sure. And hair loss is, as you know, devastating for so many women, so many families.
But it's like you were saying, Juju, earlier, and you were saying this too, Marie, it's not about vanity. I mean, when you lose your hair, it's like you can't hide it anymore. People know that something's wrong. And if you have small children,
it's very frightening.
Yeah, exactly.
And that's what Dita was saying, is that her colleagues didn't know, her friends, only the people she wanted to bring into that private circle. But to me, the key was the oncologist at New York Hospital. I asked her point blank, if you got breast cancer and you needed this chemo, would you do it? And she said, I'd put myself in the clinical trial. I mean, she recognizes and weighs the risks and feels very comfortable with it.
It's interesting that nurses did a lot of these early studies, and I think this is something, the typical medical profession, we think of survival and good outcome. We don't work so hard sometimes on treating the side effects, but I think we have to recognize how important hair loss is. And if there are techniques, this is the 21st century. If we can find a way to simply, inexpensively help women not lose their hair, that's huge.
But I got to say this, ladies, and I said it before and I'll say it again, I am not my hair. In DRE, you got to remember that. You're not your hair, though it is a huge issue. But people should be made aware of this option. And have the choice, if the choice is reasonable for them. That. All right.
Amen to that.
Thank you. You can find out more about cold cap therapy and the Rapunzel Project by going to our website, abcnews.com/GMA. I really enjoyed that. Thanks, ladies.